like to sort of go back to WHO and its constitution. Interestingly, and I know you know this, Peter, but WHO was actually created out of a crisis. It was created in the post-World War II era, interestingly, and fast-tracked to 2020. It's being, criticized in a context of crisis. So you've already alluded to some of the big challenges that an organization like this that has a huge mandate faces. But I'd like to sort of turn our attention to what do you think is really needed to strengthen the organization's ability to act collectively on behalf of member countries in the face of a pandemic like this one and other crises that are coming down the pike.
Thank you, Erica. And it's really terrific to reconnect with you as well. We were colleagues for many years when I was at the University of Toronto, and thank you for that question. I think the first thing that's needed on the part of all of us is humility. Mm-hmm. And that's why I tried to make the point that we're always learning. WHO is, we all are. And that's very, very important characteristic, I think, for all of us. Secondly, what I'd like to say is that when Dr. Tedros came in 2017, and I had the privilege of coming with him, he initiated a transformation of WHO that is probably the biggest reform of WHO in its 72-year history. Mm-hmm. He brought in a general program of work, which is essentially a strategy with a triple billion target, 1 billion more people with universal health coverage, 1 billion more people better protected from health emergencies, 1 billion people living healthier and healthy and well-being, with healthier lives and with well-being. That's already very unusual to have a quantitative target across the whole organization where the budget supports it, the investment case supports it, there's a results framework, there's measurement, it's driving change. So the platform is already one of significant reform. Having said that, in the specific area of health emergencies, it's very clear that the world wasn't prepared. Mm-hmm. And, Dr. Tedros talks about this cycle of panic and neglect. So I don't want to go into detail about the particular reforms there because we've struck, or an independent panel has been struck, and it's very important that we listen carefully to their recommendations. But I think to answer your question about what we need is we all need to be humble. We all need to recognize that these institutions are already reforming. Mm-hmm. I mean, WHO is a results-based organization. Mm-hmm. And that we all have a lot to learn, and we really look forward to the recommendations of the independent panel.
Great. Yeah, actually, and the next question we have from the audience is that, which is really around the new normal, if there is such a thing for WHO. So we're all requested to prepare for a new normal in all aspects of life. Could you estimate what would be the new normal for WHO, or what would WHO look like in 3 to 5 years? Actually, and I'm just going to read the comment was, the structure of it, its regional structure. Any thoughts about what might inform that? Within the confines that you're able to answer that, I appreciate that may be a difficult question for you to answer.
Yeah. So, WHO will welcome the recommendations of the independent panel in terms of the emergency aspect per se. And of course, that panel is looking at the international response generally, including but not limited to WHO, and it will be reporting back to all member states. And so I think there'd be a lot of important recommendations made, and we'll have to learn. I think, I didn't appreciate when I came here just how significant a footprint WHO had in 149 countries. Mm-hmm. And actually the bond of trust between the governments, and particularly the health ministries in those countries, and WHO supporting them. And I think what COVID has shown is the importance of WHO and of the multilateral system. Maybe the last point I'll make is I mentioned that the stimulus spending in G20 countries has been more than $10 trillion.
Mm.
The expenditure of WHO is about $3 billion a year. Its budget is about $2.5 billion. Its expenditure is about $3 billion. And because of different ways of budgeting, it's not overspending. And so I think we really have to ask ourselves about that. The budget of WHO is the same as the budget of a large teaching hospital.
Mm-hmm. Mm-hmm.
And we see just how important WHO, but also the whole multilateral system is. And so I hope that it will be a multilateral system and a WHO where the financing actually matches the risks. You know, we did an investment case where we showed that based on different types of data, that the return on investment in health emergencies in WHO, their published investment case was like 8.1-fold or something. Well, it's not 8.1-fold, it's like 1,000-fold when you actually look at what happened with COVID. And so I think we'll have a WHO that continues to be humble, continues to be well-led, continues to be extremely science-based, continues to support governments, continues to promote primary health care in the ways we described, has quantitative goals, has learned the lessons of COVID, is helping countries in the world to get back on track towards the Sustainable Development Goals, and where the support for WHO is commensurate with the task that it's asked to take on.
Yeah, it does kind of remind, I think that's great. It's hard to boil it down to one thing. It's such a complex field. But when you yourself said when you arrived at WHO, there were many things you learned arriving there. And so understanding institutional context from the outside versus the inside, I think has been, you're always learning, right, at all stages of one's career. So I thought that was really an important point you made.
Yeah, and you had a WHO element to your question too that I didn't glom onto, but I mean, the main thing I've learned at WHO is how important WHO is. Mm-hmm. I was kind of a critic of WHO in the first instance, and many people are, and certainly there's stuff to criticize, but you know, when you look at it in a crisis and even before the crisis, it is so essential, WHO and the multilateral system, to the poorest and most vulnerable people in the world. It is so essential. And you asked what I learned. Maybe that's the biggest thing I learned.